Good morning, everyone. Well, good afternoon if you're in Sri Lanka. My name is Tim, and I'm from the Anticipation Hub, and we're joining here today to talk about an institutionalization of anticipatory action in Sri Lanka. So the Anticipation Hub and the World Vision Lanka and the Sri Lanka Red Cross Society produced a case study on this theme last year, which we will share. I'll put those in the chat for you in a bit. And today we wanted to hear from some of the people who've been involved in the process, so hear from them directly about what worked well, how they managed to institutionalize this approach within their disaster risk management infrastructure so efficiently and so successfully. But one of the reasons of the pause between the case study being published and this conversation today is, of course, that very tragically, a major cyclone hit Sri Lanka in December. So we thought that to start today's conversation, before we talk more about the case study and about anticipatory action, we're just going to hear from the director of the Disaster Management Centre about the latest situation in terms of the response to Cyclone Chathura. So if I could perhaps invite you to open your camera and speak, then we'll start the conversation today just with an update about what's happened with Cyclone Chathura.
Thank you, Tim. Chandrika, can you share the screen? Can you see my slides?
Yeah, we can see them. Yep.
Okay, thank you. So I'm the Director Preparedness of Disaster Management Center. I'll brief on the Build Back Better strong after the cyclone. So it's a kind of eye opener for us, like almost like 22 districts worstly affected out of 25 districts in Sri Lanka. This comparatively, it's in the written or the known history, it's known as the worst case impact for Sri Lanka. So if you can see the particular changing of the surface temperature, so that contributed as far as this technical expert revealed this particular cyclone, how it gained the energy. Next slide. And this is the timeline of the event itself, the unfolding of event, because we have prepared for the level examinations and we deployed all the agencies to those locations. And ultimately, 26th, we have initiated this warning, the landslide and flood warning. Then, the spill gates open. There onwards, this particular thing impacted, or rather, within 12 hours, midnight, the impact had happened in 28th of November. So the next day morning, of course, some areas disconnected with roads and isolated locations were there. At the same time, the electricity goes down, communication down. So the responding or rather reach to those area kind of the particular impact that had happened. So this is the date where we had the peak of the impact summary. The person affected 2.0 million, 6.6 million, of course, affected. Then the 643 the deaths reported and 184 were missing. Now it's reduced and the deaths were increased. And also almost 6,000 odd houses were fully damaged, and also 112,000 houses partially damaged. And the peak time we have maintained 796 evacuation center, which occupied 72,000 odd communities. Next slide. Then this is the area that had been flooded. Comparatively 14% of the land mass of Sri Lanka inundated during the cyclone situation. And also this is the flood exposure map, and also the damage, houses damage map, and also population exposure map you can see, because those things now published in our website, and also the PDNA. And also Disaster Management Center activate the international charter to get those real-time images. And these are the landslide affected or rather the major landslide, that is something around 1,400 odd had happened. But the Arthur C. Clarke produced that more than 4,000 landslide had happened in the Central Hill area. So the next slide, that is the immediate response actions that we have carried out, as I mentioned, because of the connectivity or the disconnected area. Search and rescue operations were difficult, and also temporary shelters activated during the impact during the impact had happened. Then the distribution of life-saving relief items, hygiene, then emergency efforts, restore access support, and also communication established. Then the health and watch interventions were immediately deployed, and also the local volunteers, NGOs supporting the broader relief efforts. These are the assessment that we have done as the Disaster Management Center mandate, joint need assessment initially published in December 2nd. Then we have conducted 15 December Rapida, and also the grade that is with World Bank, that is much more comprehensive stuff in 22nd of December. Then the PDNA, more comprehensive the impact analysis we have produced that reveal 4.1 billion US dollars impact of the damage. Next slide. These are the foreign donation coordination as per our mandate. We have coordinated by establishing a coordination center as the consignee of all the donations we received, and immediately deployed those stuff to the relevant districts and the persons. And we have received a lot of the relief items, even the helicopters for operations, then C-130s for air transportations and all. Next. These are the international support, as I mentioned, the helicopters from India, the military to military, diplomatic to diplomatic, government to government assistance also received. Even the UN agencies, Red Cross also providing us, and also the air naval support rescue also conducted with the different global entities, response expert from different countries participated during the response or the search and rescue operations, and also critical infrastructure support. The Bailey bridges put in place, India supported us, and also Pakistan had supported. And also hospital, we have on-site hospitals were established during the period. At the same time, expert teams came from European Union, even the Italy civil protection. Likewise, they have been here and investigate on the sustainability, or rather the restore those things or demolish those infrastructure and rebuild again with resilient features that also discussed, and also they have produced reports. Then the multiple humanitarian flights came with all the assessment. These are the WASH team, China, India, this response team, and also the EU supported. These are the locations that we have deployed. Next slide. Next slide. Then with the submission of the PDNA, post disaster need assessment, that also supported with the World Bank, ADB, UN, and also Disaster Management Center, coordinate with the National Planning Department. We have produced the PDNA, which shows for 3.4 billion US dollars the impact, and also initiate with the rebuilding Sri Lanka, that is the recovery plan. So initiate with 450 million US dollars from India, and also the other countries was supported with their the financial assistance were given. So this is exactly up to now the Disaster Management Center with the coordination of other entities what we have done. Next slide. Thank you. If you have any questions, I'll be happy to answer. Tim, over to you.
Thank you very much. Yeah, that was very interesting and good to hear that the response is well underway. And there might be some questions at the end, about whether would have been possible if the frameworks are in place to do some anticipatory action ahead of that cyclone, if that was possible. But we can save those for the end. And so, yeah, now I'd like to move on to the main subject of today's community conversation. And we're going to be talking about institutionalization and what that means and how it was achieved in Sri Lanka. But before we get into that, I'd like to ask Damien from FAO and from the Asia Pacific Technical Working Group on Anticipatory Action, just to give us a brief overview of what we actually mean by institutionalization, because there may be some people here who have heard the term but don't exactly know what it means in each setting, and also there may be different ideas about it. So yeah, the Asia Pacific Working Group have done an awful lot on kind of trying to establish this. So Damien, perhaps you'd like to take over and explain for us.
Thanks a lot, Tim. I will not take too much time. I don't have any particular slides to really insist on the need for institutionalization. Quite a difficult word for a French speaker. Anyway, what I would like to stress is the recent results of the regional anticipatory action mapping, which is showing that we are still having a growing number of anticipatory action frameworks in the region. So from 101 anticipatory action frameworks identified in 2023, 3 years ago, we have now reached a total of 169 anticipatory action frameworks in 18 countries in Asia and the Pacific. It's growing. Every year we have a growing number of anticipatory action frameworks. And in Sri Lanka, if I am not mistaken, there are now at least 8 anticipatory action frameworks established for a number of hazards that can be predicted. The main category of anticipatory action frameworks in Sri Lanka is for flood, but there are anticipatory action frameworks for drought, for animal disease outbreak being developed, and I think there is one for human epidemic as well. And with the growing number of anticipatory action frameworks, there is obviously a need for harmonization, standardization, coordination, and the government should take the responsibility of guiding anticipatory action at country level. So while the concept was pushed mostly by humanitarian actors at the beginning, we are reaching a stage in the region where this concept needs to be integrated into national practices. And I believe this is what institutionalization is about, making sure that the concept is integrated and sustained beyond the time of a given project, and making sure that collectively humanitarian actors can support government to provide anticipatory assistance when an extreme event is being predicted, and focusing on the most at-risk areas. So this process of integrating a concept in national practices will require a number of efforts. It's not going to happen rapidly. The process can take very different pathways depending on the country and the context. But at the regional level, we have started to identify a number of entry points for the institutionalization to happen. We call those entry points AA bricks. We have identified 9 anticipatory action bricks which can contribute to this institutionalization process. I will not develop too much on the 9 bricks for AA harmonization and institutionalization, but I will just give maybe 3 countries example where this anticipatory action institutionalization is happening, and it can be at different level. So I guess the most known example of institutionalization in Asia and the Pacific is probably the example of the Philippines. In the Philippines, the government passed in September 2025 a new law, Republic Act 12287, which explain how the local government units will be able and allowed to use a certain percentage of their preparedness budget for anticipatory action in a state of imminent disaster. So the institutionalization in the Philippines is being backed up by a new legislative document. And I think that's really like the ultimate brick that needs to be addressed in a country to be able to promote the delivery of anticipatory assistance with public financing. So that's very advanced. But you can see in a country like Bangladesh or a country like Nepal, the institutionalization happening perhaps at a lower level, but already quite effective. So in Bangladesh, the humanitarian community and the government have developed national early action protocols for cyclone, for flood, and they are developing more national EAP right now, one for flash flooding in the northeast region. And I think there are some other national EAPs in the making in Bangladesh. And this national EAP is informing on the common trigger methodology and the official AA options that can be picked by humanitarian actors and possibly government actors in the future. What's missing in Bangladesh is probably the financing of anticipatory action at the government level, but standards have been approved for certain hazards and are guiding NGOs in the planning and the delivery of anticipatory assistance, with government really taking the lead on the issuance of trigger information and on the design of the anticipatory action. In Nepal, perhaps one level lower, the government has passed a shock responsive social protection standard, which indicate how to, for instance, deliver cash-based anticipatory action through government channels. So this institutionalization or standardization in Nepal is really focusing on certain type of anticipatory action. Again, not explaining how government might be able to trigger anticipatory action or how government could perhaps finance this cash-based anticipatory assistance, but at least there is a certain standardization already happening with government saying this should be done like this. So 3 different examples of institutionalization in Philippines, Bangladesh, and Nepal, and again, not necessarily using the same entry points and not necessarily, using the same pathways. So pathways can be different, but we really need the government to guide the delivery of anticipatory assistance, being through the common trigger methodology, common AA package, or possibly with the adoption of a new legislation, which I think is the ultimate option in certain contexts. But very much looking forward to hear from the Sri Lanka case study. Over.
Thank you so much, Damien. And with that, I will hand straight over to Ganga from the Sri Lanka Red Cross Society, who's going to talk us through some of the milestones that were achieved in Sri Lanka. And then I think straight after Ganga's presentation, we'll move straight on to our colleagues from the World Food Programme and World Vision Lanka, who will look at how the community of practice around anticipatory action was formed. So Ganga, over to you.
Right. Thank you, Tim. Can you hear me? Can you all hear me?
Yeah, we can hear you.
Loud and clear.
Yeah. Right. Thank you. Let me share my presentation. Right. Let me start the presentation that we are going to present about the achievements in Sri Lanka. I would say it's a journey in Sri Lanka from 22 to 26. So the first uh, step towards anticipatory action was taken by the World Vision Lanka in their private project in Nuwara Eliya in 22 and up to November 23. That was the main milestone in the country. And then from the Sri Lanka Red Cross Society, with the support of IFRC, we conducted one dialogue platform in 23. That was the first ever, like in the journey. That is the first workshop or the gathering that we discussed about the anticipatory action. And then with the results of that discussion, we started the Anticipatory Action Technical Working Group in the country. That is another achievement in the country. And this point onwards, what I'm going to explain as achievements or the milestones in the journey are a joint effort of this technical working group. And then in the next month, we develop our action plan for next 2 years, that is 24 and 25. We had under 5 thematic areas: institutionalization, learning and capacity building, anticipatory action, operationalization, pre-arranged financing, and early warning and triggers. So the activities carried out then in the next 2 years under these sections. And then we started advocacy with the government agencies at different levels, with different government agencies. So we started advocating for institutionalization, and parallel to that, we developed the capacity of the anticipatory action community, that is the practitioners, humanitarian agencies, as well as the government. And another milestone or achievement is we had the South Asia Dialogue Platform in Sri Lanka, hosted by the Sri Lankan government jointly with the Sri Lanka Anticipatory Action Technical Working Group. And at the same time, we had the Sri Lanka Dialogue Platform as well in 24. And this was again the institutionalization and also opportunity for learning and capacity building. And then the next step was having the National Anticipatory Action Working Group, where the government was on board in the process, and this is the leading body at the moment, led by this is the leading body in the country under the Anticipatory Action work led by the government. And with this, we started the operationalization of the anticipatory action. So we did one trigger development and operationalization workshop, and then this is another discussion on how do we do the trigger development and operationalization. And again, this year, we had the national dialogue on anticipatory action on sexual reproduction and health. Again, it's on the operationalization on how we can operationalize anticipatory action. And again, we are in the process of finalizing the anticipatory action roadmap for the country from 26 to 30. So that will be launched soon in the next month. And this is another achievement and a milestone of the journey of Sri Lanka. And parallelly, we have anticipatory action projects in the country. So some projects have been completed and some are ongoing. So these are the operationalization process at the moment. And thank you very much.
Thank you, Ganga. And yeah, perhaps we can now move on to how the community of practice was established. Because that was quite a critical milestone, I think, in the process of anticipatory action becoming embedded in Sri Lanka. So yeah, the speakers from World Vision and World Food Programme, please go ahead.
Okay, thank you everyone, and good afternoon and good morning for everyone. Chandrika, can you share the slides, please? Chandrika, I guess the slide is not visible. Chandrika, can you put into the presentation mode then? Yeah. Thanks. So from World Vision side, I will quickly, briefly take you through our first pilot project. So everything was started from the pilot project. So World Vision, especially, we had a project in 2022 to 2023, which was implemented in 6 countries. That is the pilot project for World Vision on anticipatory action. In Sri Lanka, we had this program in Nuwara Eliya district, which is Nuwara Eliya and Ambagamo DS divisions in Sri Lanka, which is in central part of the country. So we mainly focused on the hazard was the landslide and flooding. And through this project, we when we started this project, we really wanted to look at how we can really experience the anticipatory action in those 6 countries with their country context, and how we can really establish a very promising anticipatory action project. So therefore, in this project, we achieved developing a protocol for landslide and flood, for especially for Sri Lanka. And also we developed an operational framework anticipatory action. Then we really wanted to have a guide to really direct us how we can really implement the anticipatory action in a country. So then we have developed the anticipatory action guide. Then the achievement, we have shared all the lesson learned and the learning with the UN and the government organization. And also we also engage in strengthening in collaboration with national level and the regional level and the global level. So that was the brief about this project. And while we are implementing this project only, we have realized in Sri Lanka, we need to really have a working group, national level working group. Therefore, we, together with Red Cross and the other team members, we have started the Anticipatory Action National Technical Working Group, because it is very important whenever needed the technical advice and developing triggers, and also doing advocacy, because we found that the advocacy is very important to scale up this anticipatory action project in Sri Lanka. Therefore, we collaboratively started the anticipatory action technical group with the NGOs and the sector. Then after my presentation, WF will take us through how this technical working group have developed and now how the functions are in Sri Lanka. And also this is Chandrika, the first slide. So the dialect platform, that also one of the platform that have given us to really experience the anticipatory action and also share the learning with other stakeholders. So this is how World Vision Lanka is really strengthen the anticipatory action in Sri Lanka. And also right now, most of our projects are completed, but we were looking at our strategy, how we can really expand the anticipatory action in the country with our development programs. So this is already, I guess, Ganga also explained about this formation of technical working group. We had this 24 organization in this technical working group, and the technical working group was co-led by Sri Lanka Red Cross, World Vision Lanka, World Food Program, and also IMI, International Water Management Institute. And when we get together, we initially developed a joint action plan and collaborative initiative to really move forward in with anticipatory action in Sri Lanka. So, next slide. Next slide, please.
Jiba, I think Gautami will explain the next slide.
Okay, thanks. Yes, Gautami, over to you.
Thank you, Deeparaj, and good morning and good afternoon to you all. And thank you for organizing this important event. So I will emphasize how now functioning of this technical working group now along with the national technical working group. I would like to highlight again now as to complement Deeparaj. Yes. Now he explained how this group was formed and who are the members, and also Ganga clearly explained what was the functioning of this anticipatory action technical working group during last 2 years. And now Ganga mentioned, so I want to appreciate and congratulate government of Sri Lanka, especially Disaster Management Center, stepping forward and taking initiative to form National Anticipatory Action Working Group under the leadership of DMC. So actually, this was the ultimate goal of Anticipatory Action Technical Working Group. And now we are very closely working with this national working group. And we don't want to duplicate, or we don't want to have a parallel structure, But I want to emphasize Sri Lanka Technical Working Group is supplementary to the government-led national working group, and also it always complement the government initiatives. And why we want to continue this working group further, because we trust we working as a humanitarian partners, also it adds strength to the government. So we can discuss, sometimes bring everybody together, it's not easy. So we as a humanitarian partners, we come together, we discuss, and we always support government as a team. So this is the advantage and beauty of this having two groups. And our still continue to promote knowledge sharing, technical discussions, and collective learnings, and future direction and continuity collectively decided by the members. So again, I want to highlight, this is a group of like-minded group who are interested, who want to leverage, and who are fascinated about the anticipatory action. So at the moment, these two groups are functioning with a very cordial relationship, complement to each other, especially to leverage the anticipatory action agenda of Sri Lanka. So I trust this is what I want to highlight. Chandrika. Thank you. So
thank you,
that's all from my side.
Excuse me. Thank you both very much for sharing about the technical working group and how the two working groups go together. And next we're going to actually hear from Winston from FAO, who's going to talk about how the government were brought on board. Because obviously you can't have a institutionalization process if the government aren't engaging with you. So Winston's going to explain about how the government in Sri Lanka were brought into the discussions and how the part they played. And then we're also going to hear, I think, from two of the government organizations who've become very active in this approach. So Winston, over to you, please.
Okay, thanks, Tim. So as you all know, from these, that our initiative we started somewhere in 2022. So most of our initiatives are still at the early stages at the pilot level, and also most of these initiatives are kind of project basis. So still within these 3 or 3.5 years, we have not done any activations yet. Because some protocols are being developed and the limited refinancing available. So So since this AA is mainly kind of project basis, so we have kind of resource scarcity of resources. So first thing that we have to do is we need to perceive this AA as a process. So where this government ownership is pretty much important, even after the project transition, the government need to take leadership to act. To monitor the triggers and activate the triggers in collaborations with the relevant agencies. Of course, Sri Lanka at the moment, as you're aware, after the economic crisis, we are under the kind of IMF program. The government agencies itself have some limited resources, but in the long run, the government ownership for this process is pretty much important to the institutionalization. I think the ongoing roadmap for 2025, 6 to 2030, next 5 years, might be the first pathway to push this institutionalization process. So far, so as Damien mentioned, we have 8 anticipatory action protocols being developed. In addition, some agencies like UNDP, they supported with the support of government to strengthen the early warning systems. So that might helpful in scaling up the anticipatory action process. So this process, we can say after the pilot projects, now we are in the process of scaling up and institutionalization and the technical collaboration with the government agencies on trigger development and the trigger review, because triggers it cannot be static. Sometime we might need to review the triggers again, and the dialogues between the government agencies, because most of the time what we observed is at the national level there's a good coordination with the technical agencies and the DMC, but sometimes we often saw that the coordination between the sectoral agencies like livestock, agriculture, that needs to be improved to further strengthen this anticipatory action system. So that's roadmap, and the working group would help to this process. And then the continuous capacity development to make everyone in the understanding on the AA on the same page, because sometimes we have different perspective on AA. So the continuous dialogues and the advocacy and the capacity development is pretty much important to bring all the stakeholders on the same perspective on AA. And finally, the government-driven approach is pretty much important to towards develop the system for impact forecast. So that is very much important, because AA need very accurate forecast with the impact, the quantitative impact. So that pretty much important for this government-led approach. So at the moment, the roadmap and some ongoing projects are helping this, but still we are at the early stages. The DMC-led working group is driving this process. I hope the roadmap. So once the roadmap is approved, so everyone can work on that roadmap during the next 5 years. So that might drive the institutionalization in a proper direction. Thank you, Tim.
Thank you, Winston. And I think we have a couple of speakers from the government as well, who we can hear from about how they became involved with the anticipatory action approach in Sri Lanka, and perhaps where we're at now, because it's close to a year since we did the case study, so there's undoubtedly been some updates. So I think Mr. Chathura is still with us from the DMC, the Disaster Management Centre. So perhaps you could talk to us a little bit about what the government's role is in anticipatory action in Sri Lanka today, and also how the DMC became involved with the community of practice with the different organizations. Over to you, sir.
Thank you, Tim. In fact, as you can see on my slide, we have initiated this in the 2025 March. And the disaster management, as per the mandate given by the Act number 13 of 2005, we have developed the National Disaster Management Plan, where we have these 3 particular provisions to implement anticipatory action in Sri Lanka. That is the early action, early warning, and free financing. But it has a alternative financing or some different terminology there. So based on our mandate, we have initiated this stuff, or rather the anticipatory actions with different agencies. Initially, the government have initiated, then the ADPC come up with SNAP, National, that's Sustainability Anticipatory Action. Then the World Vision work with us, even the FAO and other entities work with us. So we have initiated with the National Anticipatory Action Committee and 4 other subcommittees. Especially, we have selected the 3 major components, that is forecasting and the triggers, developing triggers, then the AA operationalizing and learning and evidence, then the coordination, the policy financing and institutionalizing. So based on the forecast and triggers, of course, we have selected the major 3 hazard which we can initially develop triggers, definitions, and also implementing the anticipatory action, the provisions, like for the flood, especially we are facing this high intense rainfall, flood, or the dry spell, drought. So basically the flood and drought, then the landslide, and also the health related animal health. Those things also we have considered, and also we have appointed subcommittees for each, and also given the technical person for the technical coordination, and also one committee chair from the UN agencies or other agencies who are working with the anticipatory action. So this is the strategic mandate, 4 pillars in the institutionalizing. So develop 5-year roadmap. In fact, it's in the last or rather the latter part of developing this one. Of course, recently we have conducted the meeting. Then the technical capacity strengthening forecasting system and triggers, of course, that is going on. And the expansion and also financing, as I mentioned, there are the ambiguities with the government sector itself. At the same time, we have to have the provisions in the National Disaster Management Plan, where we have to have a kind of a face-to-face discussion on the Treasury and also the NPD and all the local authorities, where we supposed to have this free financing, and especially from the UN funding like SURF and REF funding, and also the other available funding to utilize those actions in future. But DITWA, of course, because of the DITWA, we had a lagging time, because I think 6 months gone without any actions. That is because of, we all put our effort to recover from it, and also developing this PDNA and also the recovery plan. Then the knowledge and evidence, of course, promote research innovations, that also we have to be done. That sustainable national community of practices, that scope also we are supposed to have in the strategic mandate. Then the execution, of course, the execution itself, roadmap, as I mentioned, it's in the latter part of the development. We conduct the final meeting recently and circulated among stakeholders just to get their views, observations, and the opinions. Then we'll supposed to publish it. Then the operational readiness, in fact, executions of dedicated the workshop that we have to conduct on standard operation procedures, and also the final one is ongoing capacity building, of course, continuous facilitations of capacity development program, national dialogues, and the focus group discussions have to be done. So basically, this technical thing, of course, with the technical agency, the forecasting capacities that have to be done. I think this slide will be presented by Sir Sooriyabandara. Engineer Sooriyabandara, over to you. Irrigation Department Director, Mr. Sooriyabandara.
First, I think, thank you. So as a technical organization, what I feel is for the forecasting as well as anticipatory action is one thing when we are practicing for the giving support, especially the disaster management mandatory works. So in my case, I think as a technical organization, first we must have some mechanism for analyze the disasters as well as the risk behind each and every event, maybe in the country disaster is concerned. But in my department, which is mainly two disasters, one is the flood as well as another one is the drought. So in the management part of the flood and drought, we have one thing is we have some data collection and analytical as well as the water management. So we are supporting for actually by analyzing, giving as possible as early and higher lead time warnings as well as this is supporting informations to the organization, technical support. In addition, we in drought management, we normally doing water management practices as well as some storage capacity improvements as well as farmer community support systems. Therefore, in this anticipatory action procedures, we have support different category of support as well as the participation of each and every workshops as well as meetings to aware the situation when we are facing some of the event in the past as well as for how to improve our capacity. So to do that, we have a different category of people who are expecting our services, like common people as well as some of the industry managers for the event data disaster management and risk reduction procedures. So in that case, we are now trying to do certain improvement our mandatory the risk reduction as well as the avoiding risk for some of the areas. So to do that, we are now try to give the more reliable and accurate warnings as well as a more higher lead time. So to do that, our main system is to taking more data sets in the field as well as analytical introduction of analytical tool for better analysis. That is what now helping different organizations like FOA and World Vision as well as organization come with us and giving their help as well as sharing their knowledge for building the better coordination with the organization as well as a better understanding of how to do this process. So I think in my experience, this might be further improvements as well as this anticipatory action procedures must be built throughout the country, and we try to expand it some other options as well as some methodologies which maybe have given to our messages to the society as well as give the reliable information also. Thank you very much.
Thank you very much. Yeah, so we've heard from all the different sides now that have been involved with institutionalization in Sri Lanka. So we've heard from the government, from the humanitarians, and the other different partners. I'd now like to open up the conversation to all the other participants with us today with two questions, really. One is there anything from the presentations you've heard about Sri Lanka that you think you could replicate or kind of take on board for institutionalization in your own country? And also, if there's any other questions that you have for any of the speakers or anything you'd like to clarify or provide some feedback on. So feel free to open your cameras. You can raise a hand if you like and just don't speak. And yeah, so from the other people here today, anything that you'd like to sort of reflect on from your own countries or ask the team for Sri Lanka? Okay, it might be that people are thinking, yeah, Damien, please go ahead. Yeah.
Yes, team. So certainly the creation and establishment of a coordination structure is the first step. It's the first brick for anticipatory action institutionalization, but that's not enough. There are so many other elements that might be required, and I think Winston talked a bit about impact forecasting for improving the prediction of what might happen in certain sectors. That's certainly a part of the trigger harmonization. Again, another brick that is needed, but in most of the countries where institutionalization is actually advanced, you need at least 4 or 5 bricks to be addressed. TWG is good start, but it's just not enough at all for an effective coordination and an effective planning of anticipatory action for some priority hazards. So we talked about TWG, we talked about trigger. You need to define this AA package as well at some point. What do we want to achieve? What are we trying to protect? What are the key actions that could be standardized across organization? Do we want to promote livestock evacuation? Do we want to promote protection of houses? Do we want to promote early harvesting? Those questions are very important. And the last one, which I think is not a brick that is really under our control, is are we able to deliver these assistance? And the fact that there has been no activation in Sri Lanka means there is still a bit of a barrier for AA intervention, which is the financing. If we cannot answer all these elements, I'm afraid the progress will be extremely, extremely limited. So I think TWG and roadmap is a good start, but then we really need to get a sense of what are the priorities. And I don't know if this exercise has been effectively done in the country. And we saw with Cyclone Ditwa that you might have 2 or 3 flood framework in place, but how do we use them? Where do we use them? And how do we create synergies between AA actors? I mean, yeah, again, it's very important that there is TWG, but what are the next priorities? And I could give you like 9 or 10 different elements that could be considered, but I wonder what are the immediate short, medium-term priorities for Sri Lanka? Where are the key entry points where we can maybe make a quick change? And that's what I would want to hear from the conversation. Over.
Yeah, so panelists, please feel free to respond. We're not going to test you on what the 9 bricks are, but what do you think are maybe some of the gaps still in Sri Lanka's anticipatory action framework? And as Damien asked, what are the priorities? What's the immediate next steps for the country?
In fact, let me just answer the question itself related to anticipatory action, activations, and all. So as a preparedness director, so basically preparedness is more structured system. Anticipatory action is a small window between the preparedness and response. So particularly for the Ditwa itself, we have, or rather the Department of Meteorology or the technical agency predicted 30 kilometers away. But in the book, it says National Emergency Operations Plan. So we have to be given the warning before 550 kilometers away, or rather 72 hours before. But this is a catastrophic event that we have experienced, unforeseen event. At the same time, only 12 hours lead time was there. And also at the night time. And the morning, all the landslides and all the impact had been happened. So implementing anticipatory action, it's a good thing. At the same time, the protocols and all those stuff, the subnational that we have to be developed, because national, of course, protocols, those things develop. But in the anticipatory action, basically it's community based. or rather directly we have to implement with the communities who the vulnerable communities who live in vulnerable locations. For that, of course, we need to have more precise data, accurate informations, and also the technical information. Say suppose the irrigation department, if a spill gate 1 meter, sluice gate 1 meter open, which area, which community affected, that particular information have to be there. Then the definitions on the flood, whether it's 5 meters or 2 meters, something that we have to define, and also activation triggers. So basically those things have to be implemented with the community and also the subnational level. So those things, of course, we are in the process of developing. At the same time, technical agencies have to give us the guidance and also usually developing those triggers. We are in the process. And at the same time, roadmap clearly emphasize the milestone, uh, the timeline. So where we wanted to move forward those actions, and at what time that we want to finish those actions. Likewise, initially we thought of having these 4 hazards. Then in future, of course, we might add, or rather, we are supposed to add air pollution, and also the zoonotic diseases, and also the especially the landslide, because landslide is more localized stuff. We need to have localized warning and the localized actions.
Thank you both. There's actually another question in the chat from Damien about the community-based angle, which we did talk to communities when we were conducting the case study. But I'm wondering if Jabaraj or Chandrika, because the first World Vision Lanka pilot projects were very focused on working with the communities and building their capacity to anticipate disasters. I don't know if either of you want to kind of reflect from World Vision's perspective about why having community-based activities within the whole institutionalization and the whole infrastructure for the country is important. I don't want to put you on the spot, but I know that that's something that World Vision prioritizes. Maybe if one of you could share some thoughts on that.
Tim, I was not get your question, since your voice was not really,
Sorry, just about the is that better? Yeah, sorry. About the community-based element of World Vision Lanka's projects and why they've been so important in anticipatory action, because we've heard from the government side, from the humanitarian organizations, the UN organizations, but Damien touched in the comments about the need for anticipatory action to be community-based as well. And I just wondered if you could share a couple of reflections from World Vision Lanka's perspective about why you focused in the pilot projects on working with the communities and bringing them into the project early on.
Okay, thanks, Tim. I basically I would see, because the anticipatory action protocols, when we are developing, this is one of the experience and learning as well, right? So when we are developing the anticipatory action protocol, very initially we have to decide who is going to be on this protocol. Right? Is it community going to own this protocol, or it's going to be the technical agencies or technical departments going to own the anticipatory action protocol? Because when it comes to activation, this is very important. Right, if the community owns the protocol, then the activities need to be developed based on their capacities and the funding, fuel funding especially. If there are small activities, when the community-based anticipatory action protocols are developed, it's 1 or 2 activities that can be managed by the community immediately when they receive the early warnings. If the triggers are meeting to activate the protocol, then they can really activate the protocol and they can do themselves few activities. But it's owned by the other levels, then it should be developed based on that, because since this project is implemented in 6 countries, we had experience in the other countries how the Myanmar was developed their anticipatory action protocol for their community, and it was activated very easily. And Philippines was developed their activity for the provincial council. All the activities activated and implemented by the council behalf of the community. So this is where really World Vision also looking at in future how we can really develop the anticipatory action protocols. And also for Damien's initial question, how do we really fuel the money to protocols? One option is always we looking at how we can really explore the insurance in Sri Lanka. And the second, how we can really bring the corporate partners into this anticipatory action work, how the companies and the other corporate partners can contribute into the fueling into the section. So that's from my side. Chandrika and maybe even Vincent also can share some of the experience if needed.
Yeah, so just to answer Tim's question. So in our DM system, we have at the national level, National Disaster Management Council, then DMC, the district level, district disaster coordination committees, divisional, and at the village level, we have village level disaster management committees, we have the community or committees. So the issue is still the community level committees, those, I mean, though are established by DMC, but still those are kind of perceived as an informal structure. So they are not authorized to handle any kind of financing matter as well. So yeah, so that is now, I mean, now the ball is in the DMC's hand during upcoming their Act amendment to consider how to formalize these community structures in a formal structure. So that will further strengthen the community level anticipatory action system in the country.
And also to add to that, I think so. World Vision is very directly linked to the communities, and we work across, I think, 31 divisional secretary divisions, and we are probably working very closely with this community. So, and through our different project models, there are several community structures. Apart from these village disaster management committees, we have several other committees established for several other development purposes as well. For example, we have some saving groups established under our livelihood and business development platforms, the project model. So I think